A lot of people tend to abuse malaria medication. They use malaria, any small headache, any small body pain, fever, whatever it is, malaria medication, when it is possible that what you just needed is rest. Hello, my Red Tribe, and welcome to another episode of Dr. Red Diaries. Today is World Malaria Day, and we'll be talking about malaria. Malaria is one of the most common medical conditions in Nigeria. The truth is, I am sure that every citizen of Nigeria, everybody living in Nigeria, both babies or adults or old and young, would have had malaria at one point in their life. So the over 280 million of us had malaria at one point. That's how common, one of the most common medical conditions or illnesses in Nigeria. And currently in Nigeria accounts for over 25 to 30% globally of malaria cases. And yet we still see some people, especially children under the age of 5, die from malaria when it is easily treatable, it is easily preventable. Most people wonder, how can you prevent malaria in a mosquito-dominated country? Yes, it can easily be prevented. It's possible that you may not even treat malaria. It is very possible for you to treat malaria in a year. People have not treated malaria, they've not even taken malaria medication in years, and they live in Nigeria. So that's the reason why it is possible. Before I delve right into that, let's talk about what is malaria. So malaria is caused by a parasite called Plasmodium falciparum, and it's caused by mosquito bites, and the female mosquito actually. That's what actually causes malaria. Malaria is not only common in Nigeria, it's not only present rather in Nigeria. It is present in other parts of the world, but it is very, very common in Nigeria. Now let's talk about some of the symptoms. Symptoms of malaria are very generic. Cough, catarrh, headache, fever, chest pain, body pain. It's so generic. That's the reason why a lot of people tend to abuse malaria medication. They use malaria, any small headache, any small body pain, fever, whatever it is, malaria medication, when it is possible that what you just needed is rest. Maybe you are even stressed. Maybe it's another medical condition. And it can be it can be a host of medical conditions because, like I said, the symptoms are quite common and generic. So many Nigerians treat malaria blindly and incorrectly. Like I said, we assume that every fever is malaria, we self-medicate, we don't complete our treatment, we mix drug randomly. And then to lead to what? Drug resistance, misdiagnosis, or even delayed treatment of some serious illnesses. Sometimes it might not be malaria, like I said, it might be a viral infection, it might be a chronic medical illness, it might even be sepsis or typhoid. It can be a host of other medical conditions. So it's very, very important. I would say most times, if you treated malaria once within, let's say, the last 3 months, and let's say after the next month or 3 months after, you're coming down with a similar symptom, before you go to buy that malaria medication, I would advise you to have a malaria test done in a lab. Don't just say, oh, the symptoms, they are similar now, so let me just take the medication. I would advise you against that. I would advise you to go for the test, confirm and be sure you have malaria before you take the medication. Most of the time, or in most cases, or in 8 out of 10 cases, most of the time, it is not malaria that person had. It's something else. So it is better to confirm. So to avoid what I mentioned earlier, to avoid resistance, to avoid misdiagnosis or delayed treatment of some other chronic or serious illnesses. A malaria test is quite affordable at the moment, and you can do it and you can do it in almost all labs, and even almost every hospital in Nigeria can run malaria tests. So instead of you self-treating or self-diagnosing and just popping pills, I would advise you to get the malaria test done, especially if you've treated malaria within a 3 months or even a 2 month period, or even a 1 month period, and you're still having the same symptoms. Go and run tests. Now, let's talk about the reason why people have resistance, which is quite common right now, to some malaria medication. Number one reason, which I've mentioned so many times, they don't finish medication. They don't finish their medication. After maybe 1 day or 2 days, after taking 2 doses or 3 doses, they just stop because they are feeling better. Number two reason is because they assume that any type of anti-malaria medication might work for them. No, not all cases. When malaria in the bloodstream becomes resistant to some anti-malaria medication, we medical practitioners, we switch to, there are different types of anti-malaria drugs. Actually, there are different types of anti-malaria drugs. From running tests and the symptoms that you present with, and then medical history, we tend to determine which of the anti-malaria drug that you need at that particular time. Another reason for drug resistance, especially with malaria, I mentioned it before, also in the line of drug abuse or abusing the medication, is that sometimes some of us, we take overdose. We take the full dose of the anti-malaria tablets, or sometimes we start with the 3 days course of anti-malaria injection, and then we'll now come back. After we finish that one, we'll now complete it. It is already completed with the 3 days injectables. You now say you want to complete it with another 3 days of anti-malaria oral medication. You are just building up more problem for drug resistance. So I would advise you, number one, if you have been abusing anti-malaria drug for over a period of time, if you're having any symptom relating to malaria, number one, stop taking the medication. Or rather, don't take any medication yet. Go and run some tests. Confirm that it's malaria that you have. Then let the doctor guide you appropriately on the course and the line of treatment. It may not be the regular ACT, artemether lumefantrine, that you may need to take at that particular time. It may be a different one to help deal with that drug-resistant malaria that you currently have. Let's talk about some common myths that we hear when it comes to dealing or treatment of malaria. Myth number one, which I mentioned before: once I feel better, I can stop the drug. Wrong. Once you feel better, you cannot stop the drug. You must complete the full dose to avoid drug resistance. Number two, any malaria drug can work. I mentioned that earlier. Nope, not any malaria drug can work for you. Some people that are even react to the regular ACT, the artemether lumefantrine or artemisinin based combination. Some people react to it. Some people have allergic reactions to it. Some people have allergic reaction, for example, to chloroquine. Some people have allergic reactions to other anti-malaria medication. It's not anyone that will work for you. It won't necessarily work in general, but it's not any that will work for you. You have to really be sure that you don't have any drug allergy issue or drug resistance issue to some of these anti-malaria drugs. Myth number three is herbal mixtures can replace anti-malaria treatment. It cannot replace anti-malaria drug. You might be causing more harm than good to your body, especially your major organs, your livers, your kidney. You might be causing more damage than good to it. Herbal mixture, please, cannot replace. When I mean herbal mixture, I'm referring to some herbal mixture that we make, some form of interesting concoctions that we make. Most times, what will really help to replace, let me use that word, replace malaria drugs, actually, is living healthy. Taking care of your environment, for one. Eating healthy. Eating lots of fruits that have antioxidants, that have anti-inflammatory properties. That will help to boost your immune system. They will help, because the body naturally has the ability to fight against foreign properties or foreign objects or foreign elements. You understand? When you boost your immune systems with good food, with proper diet. Yes, when your body is introduced to mosquito bites, it will help fight against it or fight it off. It is possible. I mentioned earlier people that have lived years without taking any form of malaria drug. Why? Because they take care of their body. They boost their immune system. But not those your herbal concoction and mixture. Another myth, malaria is always mild. Malaria is not always mild. So people I mentioned earlier that have died from undiagnosed, poorly treated malaria. So malaria is not always mild. Most times, again, depends on your immune system, depends on the level at which it has spread to your bloodstream. And it also depends on so many other factors. Most times, it is not always mild. All right, what is the take home today being World Malaria Day? Number one, let's try as much as possible to reduce self-medication or just taking anti-malaria drug when we feel like we have malaria. Malaria is not a feeling, it's a medical condition. Number two, I mentioned if you've treated malaria, if you had treated malaria within a 1 month, 2 month, 3 month period and you're having the symptom come again, before you go back to take another malaria treatment, run some investigation. Number three, be sure to know that you're not allergic to some malaria drugs before you take them, and confirm well from your doctor, if you have from the hospital, to be sure you don't have any allergy to some of the properties of some of this anti-malaria medication. Number five, take care of your environment. If you can, there are some mosquito treated nets that you can actually get that are very, very effective, that would really help you and even help your family members. You can use that at night when you want to sleep to actually help prevent your exposure to malaria. Malaria is common in Nigeria, but it should not be a normal thing. We should not be careless about it. And most of the time, it's our carelessness that tends to put a lot of us at risk or put several other people at risk. Take care of yourself, take care of your environment, take care of your family member, boost your immune system, work on your diet so you don't have to expose yourself to a lot of harmful substance and chemicals and take a lot of medication. Thank you very much for watching today's episode. I'll see you in my next episode. Bye.